I'm Duk-Hyun Kang, cardiologist, and I'm from Seoul, Korea. I talked about indications and timing of surgery for infective endocarditis. There are three major unresolved issues in infective endocarditis. First, the diagnosis of infective endocarditis is still difficult. Second, the role of surgery has been expanding, but the optimal therapeutic strategies is still to be defined. The current guidelines strongly recommend surgery for infective endocarditis with heart failure. However, emboli indications for surgery are more controversial. There has been concern that to performing surgery in the presence of active infection and inflammation is too risky and technically demanding. Previous observational studies comparing surgery versus medical therapy have been subject to the significant limitations imposed by baseline differences, treatment selection, and survival biases. Only prospective randomized trials may reduce these limitations. We conducted a prospective randomized trial in Korea between 2006 and 2011. The primary cohort was comprised of 76 patients. We randomly assigned 37 patients to early surgery and 39 patients to conventional treatment group. The primary endpoint occurred in 9 patients in the conventional treatment group and 1 patient in early surgery group. In conclusion, early surgery significantly reduced the primary endpoint of death and emboli events in infective endocarditis patients with large vegetations. Moreover, these improvements could be achieved without an increase in operative mortality and recurrence of infective endocarditis. My take-home message to improve clinical outcomes are first, rapid diagnosis of infective endocarditis by performing blood culture and echo within 24 hours after hospitalization. Second, identification of high-risk patients and rapid transfer of high-risk patients to specialized centers. No delays for operations when surgery is indicated. And finally, early surgery is strongly recommended for infective endocarditis with severe valvular disease and large vegetations.